Let's now officially begin the webinar with the first segment, which will be coordinated by Dr. Gazi Reaz Rahman, who actually will give you the insight of the real scenario of optometry in Bangladesh, which has started since 2010. And I think through this session, you will have a detailed insight or scenario of the optometry of Bangladesh. I would like to request Mr. Dr. Gazi Reaz Rahman to start with his presentation, and as well as if anything required from your side, please let me know.
Yeah, first of all, it's been an honor for me, and I'm so much privileged that I'm sharing the scenario of optometry in Bangladesh. So this has been a great honor for me for sharing this in front of some legendary persons of this field across the globe. And I am extremely happy that you all are waiting for knowing the exact scenario of Bangladesh of optometry right now. So here I'm sharing the topic today. So today we'll discuss about the optometry in Bangladesh and where we stand right now. I am Dr. Gazi Reaz Rahman, and I am the second batch of Bangladesh optometry, and I have completed from Institute of Community Ophthalmology, and then I have completed my post-graduation, also PhD. And now I'm currently work as an CEO and Chief Optometrist of Dhaka Optical Pavilion, and also build the first ever myopia center of Bangladesh. So first of all, the optometrist. So all know that it's a healthcare profession that is autonomous, educated, and regulated, and optometrists are the primary healthcare practitioners of the eye and visual system. That's a basic definition by the WHO. And then who are the optometrists? So the minimum qualification for an optometrist is to completing the graduation in optometry. So in our region, like South Asian region or in your country, they have to pass minimum 4 years of graduation from a reputed organization or medical. So in Bangladesh right now, only Chittagong Medical University and Institute of Community Ophthalmology is only the place where a person can completing their optometry degree. So after completing the graduation, one can be a graduate optometrist in Bangladesh. And if we can see the other region or other places of the world, then you can see in different places or different region, there's some division or differentiation that who can be optometry and how they can be optometrist. Like in the United States of America, they must have to pass the Doctor of Optometry OD. In Australia, there is OD. Canada, there is also OD. And United Kingdom, there is a Bachelor of Optometry like Bangladesh, India, or Pakistan, or it's very similar to us. And in Nepal also there is B.Optom, but in Philippines, like the USA, there is Doctor of Optometry. And by the WHO major occupation group, like there is 5 major occupation group like healthcare professionals, health associate professionals, professional care workers in health services, and there are some occupation code like 101. Yeah, is it okay, Mr. Mamun? Is it okay right now?
Yeah. Thank you.
Okay, thank you. Yeah. And according to World Health Organization, there are some classification of healthcare professions. Like first of all, there is optometry, then physiotherapy. Number 3 is occupational therapy, and then nutritional science. So in allied health profession or technology group, there are some cardiology, medical laboratory sciences, medical radiology, neurosciences technology, and radiation therapy like this. And now we'll go to the history of Bangladesh optometry. First of all, we can see here that the Institute of Community Ophthalmology, it's on Chittagong Eye Infirmary and Training Complex, was established in 1991 under the University of Chittagong, and the Bachelor of Science in Optometry course started in 2010, first time in Bangladesh. And I have mentioned earlier that I am the second batch of Bangladesh in 2011. Now the institute is conducting Bachelor of Science in Optometry course under Chittagong Medical University, because earlier the course is under Chittagong Medical College, but now the Chittagong Medical College is Chittagong Medical University. That's why the optometry course is directly under the Chittagong Medical University. And from 9 batch, it has been started. And currently, almost 167 students is doing their Bachelor of Science in Optometry courses in that institute. And that should be mentioned that this is the only institute in Bangladesh they are offering the graduation in optometry. And already 200 plus students have been passed out like us, and they all are working in the reputed organization, hospital, and in NGOs or international institution. So here you can see our institute, where we have started our journey, and this is the only institute in Bangladesh. Now I will share the model for community eye care. So basically, there is some model for community eye care, how the structure should be happen. Like one effective current model, this is developed by the L.B. Prasad Institute from Hyderabad, India. And for every 1 million people, the team should be 1 ophthalmologist, 4 optometrists, 8 eye care workers, 8 ophthalmic assistants, and 16 ophthalmic nurses. So that should be the model for the community eye care, and that should be followed like a country like Bangladesh or subcontinent. Now I'm sharing the table for the ophthalmologist and optometrist ratio. So here we can see some countries ratio, like how much they have the ratio is obtaining in these countries, and what's the perspective of their countries ophthalmologist and optometrist ratio. So here you can see, if I looking at Australia, every 1 million population has only 39 ophthalmologists, but 4,941 optometrists. So the per optometrist is there is 216. But if we look at the scenario of Bangladesh, it's only 1.29. So it's a massive differences between the established countries like Australia, USA, New Zealand, UK, like this. Even our neighboring country like India has 7 optometrists per 1 million population. So we are lagging behind so much on this ratio. And now we'll discuss about the tasks, including so what we are actually doing here in Bangladesh after completing the optometry, or what we should be do, like accessing the ocular health and visual function, visual acuity, refractive error, or the other functions related to the vision care, and then detecting, diagnosing, and managing eye diseases, and then the consultation with the referring the patients to ophthalmologists for further evaluation or further disease evaluation for this, and diagnosing the eye movement disorders like binocular function or any kind of abnormalities or anomalies, and then prescribe lenses, contact lenses, low vision aids, and checking the sustainability and comfort of the patient. Then we can also doing the prescribed exercise to coordinate movement and focusing of eyes, and also managing programs for eye movement disorders, and instructing and counseling patients in the use of corrective techniques and eye exercise. So what are the currently career opportunities for the optometrist in Bangladesh? Me, myself, working 9 years as an optometrist in different organizations like Chittagong Eye Infirmary, in Dhaka in Addin Medical College. Also, I'm working in Nepal Health Ministry. So there are a lot of scopes for the optometrists in Bangladesh to work in abroad, also work in Bangladesh. So what are the actually opportunities here in Bangladesh and internationally? Number 1 is the eye care hospitals and institutions. Number 2 is education sector. Like he can serve as a lecturer, he can serve as an assistant professor or professor in university or in the ICO. Then as a scientific research, few of our seniors and also juniors are working as a researcher in Bangladesh right now. And number 4 is corporate sector, then the private practice. So some of our optometrists already built their entrepreneurial center like Vision Center, myopia center, or their personal chamber in Bangladesh, and work for an optical chain or under an optical store. So it's very common in South Asian region like India, Nepal, Pakistan. So there are a lot of optical chain in Bangladesh right now also. So they are working there as an optometrist. And number 7 is public health specialist. So those who are completing their graduation in Bachelor of Science in Optometry, then few of us is doing their post-graduation in public health. And that's become they are going to interested in public health, like public health scientist or public health researcher. So there is some combination of optometry and public health. And the number 8 is industries and companies. That's you know better than me. Like some of us is working in JICE, Essilor as an ophthalmic practitioner or in marketing or as a director. So it's huge scopes in right now in Bangladesh. And the interesting fact is, nobody is unemployed in Bangladesh even after the passing out from the institute. Nobody. And the role of three levels of eye care in Bangladesh. Number one is primary eye care, that is vision centers. So in vision centers or the structures of vision centers, actually the optometrists are playing the major role in Bangladesh. Like I can explain it very short, like what is the primary eye care in Bangladesh? It's like there will be setup for the primary eye care. There will be some refraction tools. There will be some primary measures for the detecting the diseases. And there will be some patient's waiting room also. So in that places, in primary eye care, so can you hear me? Yeah. Yeah. So in primary eye care center, one optometrist will firstly check the vision, then will go for the refraction, and then he will check out is there any pathological abnormalities or any problems, then he should be referred to the ophthalmologist. So this is the primary eye care setup in Bangladesh, and the optometrist is the major role, playing the major role in that places. And then coming the secondary eye care services like district level hospital. So in district level hospital, it's kind of dynamic work than the primary eye care. So in district level hospital, there is a combined work with an ophthalmologist and optometrist or ophthalmic assistant collaboratively. Then they will work like if anyone coming with any corneal problem or corneal diseases. So when the patient will come, the optometrist will check the vision. He will do the preliminary and primary checkup, and then the patient will go to the ophthalmologist room, and then it will be done like cooperate with ophthalmologist. And in tertiary eye care services, which is the regional level hospital and the topmost level hospital or services in Bangladesh or subcontinent region, in that type of tertiary eye care services, when a patient comes, so there are a lot of rooms and there are a lot of divisions where they can go. But first of all, they will come to an optometrist for the vision checkup, for refraction, and if there is any problem happen or any anomalies or abnormalities find out, then he will be referred in other room. And there are lots of variations with the work, because you know that there are low vision room, there are contact lens, there is orthoptics, and there are also ophthalmologists in a tertiary level hospital. So there are the three level of eye care right now in Bangladesh, and this is I'm showing now. Then what I have said that primary level role, number one, in Bangladesh, the primary level role is like community survey, because our institute, our mother institute, always going for the community survey, like exact scenario of the child vision status, or the school going children, what are they are doing, or what is their present condition of vision. So always we go for the community survey and school screening, because it's very important. If a children or if a boy or girl is detecting the problem earlier, whenever they'll go for the school, then it will be very easy for their treatment. So it's very important in Bangladesh, and the ICO, Institute of Community Ophthalmology, Chittagong Eye Infirmary, always doing this since 2010 with the help of optometrists, and basically the optometrists are doing this in Bangladesh. And then also there is health campaign, because it's not all about optometry. There will be some health campaign, like they have to aware themselves. They have to aware themselves about their eye condition, like what they should do, what they should eat, how will be their lifestyle for maintaining an healthy eyes. So that also important in a primary level role. And then the important task is refraction, dispensing of spectacles. That's very common. And management of common ocular diseases and ocular emergency, as well as referring to specific department and ophthalmologist. Then the coming the secondary level role.
My sound clear?
Yeah.
I'm sorry, I will make mute. Sorry.
Okay. Yeah. Okay. Sorry. Okay. Then the secondary level role. This is private or community or vision center oriented eye care services. And in that places, what I have mentioned earlier, that diagnosis and treatment of common ocular diseases, then the basic thing, refraction, spectacle dispensing, more specific vision therapy, and there should be mass geriatric and pediatric vision care. That this portion is absent in the primary level eye care services. And also in this secondary level role, referral of ocular emergencies like that can be glaucoma or corneal damage or any other severe problem. And there should be systemic illness to ophthalmologists and other medical practitioners. And in the tertiary level role, number 1 is contact lens services, low vision services, binocular vision services, sports vision ergonomics, social welfare and health organization, ophthalmic products industry. And the interesting thing is that there are a lot of innovations currently now in world, and the optometrist of Bangladesh is adaptable with this right now. Like they are practicing myocare management, myopia management, orthokeratology, and also the other latest technologies and innovations on this sector. So here you can see the nomenclature in various sectors. What I have discussed, like there are a lot of positions for the optometrists in Bangladesh. Like there is a level 5 optometrist, optometry officer, then consultant optometrist, senior consultant optometrist, like associate director or director. There are a lot of positions right now in Bangladesh. Now, this is the demographical status of the Bangladeshi optometrists, how they are pursuing their degrees and what they have completed in the sector of education. Like I've already said that total number of graduates, it's only 200 plus in Bangladesh. And inside of this, the 1%, only 1% is PhD holder, only 3% is B.Optom, and others such as deviating in public health sector, like only 8%, 0.5% is OD, and 0.5% is diploma degree after the graduation. So the higher education is a bit less than what we should expect in this sector. And the working status, we can clearly see there that almost 80% is doing the hospital-based job, and the second is institutional, then research, and then optical industry. And the entrepreneurship is very low right now in Bangladesh. That should be increased. Here we can see the blindness scenario in Bangladesh. It's 40% children, and then the 1.5% blindness prevalence rate in last is 30 years or more. So this is the refractive errors in schooling children of northwest of Bangladesh, and it was a study of 2018. And also Muhammad Mohit sir has conducted an research on refractive error, presbyopia, unmet need of spectacle. Extremely sorry for the interruption. And here we can see the international APB. And what's the global action plan for the optometrist? It's very well-known poster for us. And then we go for the how optometrists can play an important role in eye care in Bangladesh. So here you can see the early detection of the cataract and vision-threatening ocular pathologies with the timely referral to the ophthalmologist, and then diagnosis of refractive errors and proper management. Yeah. And the low vision management, rehabilitation, and also the visual impaired and blind patients. Then the school screening programs and eye health screening programs in community level, what I have said earlier. And then the providing vision therapy for the children who are amblyopic, social awareness, and by establishing proper referral system to ophthalmologists. So it's all are important for playing a better eye care services in Bangladesh. Then Optometrist Association of Bangladesh, OAB. So this is the only association in Bangladesh where the graduated optometrists are forming this association. Those who are passing from Institute of Community Ophthalmology. So they're doing what I've said, that is school screening, eye screening camp, health campaigns, and awareness program about eye health, ocular health. And OAB is also included in World Council of Optometry in 2018, as well as our many optometrists are is there as an individual member in WCO. So we are really closely work with World Council of Optometry since 2018. And here you can see international conferences. Those who are in their Bangladesh optometrists are attended, like in 2016, 34th International Conference of European Society, then 2017. And also there are lots of conferences we have attended because that should not be mentioned because of time shortage. So this is the main conferences in recent past time. And then optometrist research paper in international and national journals. So there are really a huge number of research conducted by the optometrists. So here are some sort of scenario what we are doing here in research sector of Bangladesh. And here we can see the optometry curriculum of Bangladesh Chittagong Medical University. So there is an interesting fact that this curriculum is very close to the or almost same or identical to the New Zealand, Australia, and UK curriculum. So we are competing with the same curriculum what are the international optometrists are doing in their educational period. So it's very, very good curriculum in our country. So that should be executed by us also. And now here you can see some photo archive in contact lens patients, and the optometrists are doing contact lens practice. Here we can see Mr. Mamun. They are showing some contact lens patients to his students, and it's on tertiary eye care level. And there we can see that in orthoptics room, their optometrists are doing some vision therapy, the child with amblyopia. And there is also, this is low vision room. You can see that this is a low vision room. A patient is evaluated by the optometrist. And then there are several pictures of optometrists. They are doing refraction. They are doing some IOP measurement. They are doing some counseling and also vision checking. And this is the community level work, like they are going for a school screening program, health campaign, they are counseling, and also make them aware about the eye health status, how they can maintain an healthy eyes, and also maintaining the proper vision. So this is the optometry celebration of Institute of Community Ophthalmology. It's very old picture, and every year we celebrated World Optometry Day, World Sight Day. And also, except this celebration, we also doing some free eye campaign in Bangladesh or in different cities where our optometrists are working right now. So it's all about free services for the underprivileged population of Bangladesh, and we always doing in regular basis. Short time to actually express the optometry in Bangladesh, and I am trying to sharing it within a very short time. Thank you.
Thank
You're
you,
welcome, Doctor.
Dr. Reaz Rahman, for the insightful presentation.